Welcome to the Burn Aid channel. Thank you for joining us. Today, we'll discuss how burns specifically affect people with diabetes. Diabetes can complicate burn injuries and recovery, requiring special care and attention. Let's explore the unique challenges, risks, and treatment considerations for diabetic burn patients. Increased risk factors for people with diabetes. People with diabetes are at higher risk of burns due to factors like reduced sensation in the skin, especially in the extremities. Neuropathy, a common complication of diabetes, can prevent individuals from feeling pain or heat, leading to more severe burns. Additionally, poor circulation can impair the body's ability to heal from burns. How diabetes affects burn healing. Diabetes significantly affects the healing process of burn injuries. The high blood sugar levels common in diabetes can slow down the healing process. Impaired blood flow and oxygen delivery to the burn site can result in slower tissue regeneration and increased risk of complications. This makes wound care in diabetic patients more complex and requires diligent management. Complications of burns in people with diabetes. Burns in diabetic individuals can lead to several complications, including 1. Infections, higher susceptibility to infections due to compromised immune response and delayed healing. 2. Poor wound healing, prolonged healing times increase the risk of chronic wounds and ulcers. 3. Amputation risk, severe burns, especially on the feet, can lead to complications that may result in amputation. 4. Hyperglycemia, stress from burn injuries can cause blood sugar levels to spike, complicating recovery. Wound care and management for diabetic burn patients. Special care is needed when treating burns in people with diabetes. 1. Blood sugar control. Maintaining stable blood sugar levels is crucial for promoting healing and preventing complications. 2. Wound monitoring. Regular inspection of the burn site to detect signs of infection or delayed healing. 3. Proper dressing. Use of sterile, non-stick dressings to protect the wound and minimize irritation. 4. Hydration and nutrition. Ensuring adequate hydration and nutrition to support the healing process. Preventing burns in people with diabetes. Preventive measures are essential for reducing the risk of burns among diabetic individuals. 1. Foot care. Regularly inspect feet for signs of injury, and avoid walking barefoot. 2. Temperature awareness. Use thermometers to check water temperature before bathing. 3. Safe cooking practices. Be cautious around stoves and hot liquids, and avoid wearing loose clothing while cooking. 4. Home safety. Install smoke detectors and take precautions to prevent household burns. The role of healthcare providers. Healthcare providers play a critical role in the management of burns in diabetic patients. 1. Individualized care plans. Developing tailored treatment plans that address both the burn injury and diabetes management. 2. Regular follow-up, monitoring healing progress and adjusting care as needed. 3. Patient education. Educating patients on the importance of blood sugar control, wound care, and burn prevention. 4. Support services. Providing access to multidisciplinary teams, including dietitians, podiatrists, and endocrinologists. Long-term effects and quality of life. Burns can have long-term effects on the quality of life for people with diabetes. 1. Chronic wounds. Increased risk of developing chronic wounds and ulcers that require ongoing care. 2. Reduced mobility. Burns, especially on the feet, can lead to mobility issues and affect daily activities. 3. Psychological impact. Coping with long-term healing and potential disfigurement can affect mental health. 4. Importance of ongoing care. Continuous care and monitoring are essential to manage the long-term effects of burns and diabetes. The importance of family and caregiver support. Family members and caregivers are vital in supporting diabetic burn patients through recovery. 1. Assistance with daily care, helping with wound care, medication management, and daily activities. 2. Monitoring for complications, observing for signs of infection, delayed healing, or other issues. 3. Emotional support, providing encouragement and reassurance to help patients cope with the recovery process. 4. Educating and advocating, ensuring patients receive the appropriate care and support services they need. Important notice: this presentation is for informational purposes only. Always contact a medical expert for treatment. Download the BurnAid app for free from the Play Store or App Store for more detailed guidance on burn care and first aid.